Okay.
Good afternoon, Doctor.
Good afternoon.
Can you explain, who you are and why we're here today?
Sure. I'm Kevin Seaman. I'm the Medical Director for Howard County Department of Fire Rescue Services. And why we're here today, we are working with the group from Seattle, the Resuscitation Academy in Seattle, Washington, to deliver information here to jurisdictions and agencies so that they can learn best practices for cardiac arrest management. The overall goal is to improve survival from sudden cardiac arrest.
I understand Howard County does have a high success rate or survival rate.
Mm-hmm.
And can you talk a little? You think it's because of the managed CPR event?
I think it's a number of programs. I think we do a good job getting our units out quickly, so I think that helps. I think we have a high rate of bystander CPR, which helps. I think our providers do a great job with high-performance CPR that's spreading on shifts and across shifts, and I think we're in the process of a culture change that's becoming our standard. I think we're not quite completely there yet, but we're a long way towards that. Rapid defibrillation, and then we've got a great hospital that we deliver to. So I think when you put all that together, I think the whole system, we've got gains in each of those areas that I think are contributing to the good success.
And Dr. Bass was mentioning that, with the system network in Maryland, he thought this would, just kind of was a good partnership.
Absolutely. I think one of the strengths we have is the backbone, the system, the EMS, which is the state EMS agency. And the benefit of that is we have the same protocol across the state. We have designated cardiac intervention centers, which are centers that we can take people that have cardiac arrest. We get back from cardiac arrest to get state-of-the-art treatment, such as therapeutic hypothermia, things like that. And then the ability to gather data and really sort of measure where our performance is, so that if we make a change, we can then see, did that change improve survival? So I think that's a critical part of this. We're really proud to be partnering with MIMS to put this conference on. I should also mention that we're partnering with the Heart Rescue Project, which is a foundation, a nonprofit foundation whose goal is to improve survival from sudden cardiac arrest. So I think both of those partners are really, we're all focused on the same goal, and I think, as you said, BIMS, the state is helping. We're going to spread this. We have 4 of the 5 Maryland EMS regions here at this conference. Mm-hmm. We have 13 Maryland jurisdictions here, and I think the goal will be to spread this even further in the state to try and share the message.
Okay, thanks.
It's not necessarily a big deal. If you're in a county with 100,000 patients or 120,000 patient transports a year, and you've got 7, 10 hospitals to deal with, it's a challenge. And I'm telling you, it's going to be a challenge, but I will also say that we're here to help you in that regard. My goal is to try to figure out how to do this electronically, to link EMEDs to the hospital records, and so that we get emergency department outcome and then hospital outcome, etc. That's going to take a little while. In the interim, we're going to have to figure out how to do this manually. So here's my pledge to you. I pledge to resurrect the Cardiac Arrest Task Force, engage you guys in that, and begin to look at these issues about how we can help each other, how we at the state can help you, how we can create the structure, the infrastructure, the patient care reporting system, quality assurance, medical oversight, EMD, all of that, to help you at the local level pull all of it together and make it work. So again, thank you for being here, this is the beginning of a journey for us, and I'll tell you, this program has our full support at MIMS. I will pledge to you that we will work with you. We will try to put the elements in place. We will try to overcome any barriers that we can for you as we move forward with this. Let me just say very briefly, in terms of a question came up about discovery. Quality assurance under MIMS is protected. We have not yet lost a challenge to that law. We got several attorney generals, some of you know them, Monty McGee, Sarah Setti, who were absolutely dedicated to making sure that our quality assurance information is protected. So your proceedings, your quality assurance proceedings, your reportings, all of that fit into it are all very, very important. And we'll make sure that we try to back you up at the state level.